My experience prior to working with Beata was I went to school at Lady of Lourdes in Camden. I graduated from there and I began to work there as a registered nurse on an adult cardiac stroke unit. It was a great experience. And from there, I decided I wanted to transition to pediatric care, pediatric home care. Just I felt was a calling for me.
All right. That explains why you were interested in obtaining pediatric.
One quick note. I want to switch one thing up to we can deck for questions fine.
If you want me to
keep
reword
your
it in a way that
hands
doesn't, yeah.
Either you're not in the video, but don't kind of keep them still. It's not too loud,
Okay.
but it's loud enough that I can.
Okay.
Hear it.
Yeah, I mean, if you want to do that one again,
yeah,
whatever works.
Without the
pocket rustling. No, it's okay. I mean, that's the public speaking thing is definitely it's not something I have a whole lot of experience in, so I'll keep my hands still though.
I'll add this to your annual goals.
Yes, let's do that. Public speaking class.
Great.
All right.
You want me to
What was the?
again, or-
Yeah, let's just.
If you could just for me, yeah.
What was your experience prior to working with Beata?
My experience prior to working with Beata was consisted of going to school to become a registered nurse at Our Lady of Lourdes School of Nursing in Camden, which is where I, in fact, got my first job as a registered nurse on a cardiac stroke unit, and spent some time working there, got a lot of adult experience, and just found that my calling was I wanted to do pediatric home care.
Okay. What were your fears about pediatric home care?
My fears when it comes to transitioning to pediatric home care were, was I going to be able to work with children? It's such a diverse population. I mean, you're talking about just from a few years old all the way to 18 years old. And it's a diverse population. You're looking at different vital signs, you're looking at different psychosocial components, and when you consider all those factors, it can seem a bit overwhelming compared to dealing with an adult population.
What was the education and training like during the Intro to Pediatric course?
The Intro to Pediatrics course was very thorough, I felt. Pretty much any question I could have had, everywhere from looking at the development of a child from one set of vital signs to pretty much to adulthood and everywhere in between. I mean, it's certainly a concern when you're coming into a home. Is this a normal heart rate? Wow, this kid seems like he's got tachycardia when you're looking at an adult population. But the pediatrics course did a great job of outlining all those little nuances that you deal with in a pediatric population. Did a great job of going over all the different equipment. A lot of that you don't see in a facility hospital environment with the adults. They did a fantastic job. It was hands-on experience working with the equipment, everything from respiratory equipment to getting your hands on little teeny pediatric trachs. I mean, it's experiences that I really felt were invaluable in the transition to pediatric home care.
What was the support that you received from Beata during your preceptor training?
The support was phenomenal. It spanned everywhere from on-site training with the client, with the preceptor program, all the way through to being able to interact with the director, and everywhere in between, working with clinical managers, which are very similar to case managers in the hospital. And anytime I had a question, I had it answered. And more often than not, the training was so thorough that the questions were being answered before I even had an opportunity to ask them.
What was the education and training like?
Hold on 1 second. Let's just wait till they pass. Yeah, it didn't happen till the very end. You're still fine with the answer.
Okay.
Did you tell them or were you just wait? Oh, okay.
What was the education and training like during the pediatric trach and vent course?
The pediatric trach and vent course was very thorough. We had an opportunity to look at various ventilators, various trachs. We went over all sorts of emergency scenarios, what to expect, how to report to a physician, which isn't something that's always discussed, but it can be a little bit nerve-wracking as a nurse, because if you don't have everything lined up in such and such an order, it can be a little bit nerve-wracking calling a physician. So they covered that very thoroughly. In addition to that, they went over some emergency scenarios. So we did a prep book at home. We did a lot of training prior to actually showing up on site. But when we were there, they'd go through an emergency scenario and you would respond to it. And there's really nothing better than actually physically being in an emergency scenario to prepare for that. So I thought that the training was excellent.
What would you say to a nurse who is contemplating changing into pediatric home care from an adult facility?
I would say go for it. The transition has been amazing for me. Me personally.
Can you restate the question?
Yes, yes.
Exactly
No, no, no.
what-
Thank
yeah,
you, thank you. And I don't even know if I
just don't
did.
want you to go through the whole thing.
No, no. And if I did that on a previous one, I apologize.
Yeah.
I'm just being natural with it. So, but yeah, please do. What was the question again? I'm sorry.
Of course, it's not a written one. That's okay.
What'd you say?
It says not a written one.
That's like the best question, though.
I know.
Yeah.
What
What would you say to an adult nurse?
interested in becoming a pediatric home care nurse who has adult facility experience like yourself?
To a nurse who has adult experience in a facility, who's considering making a transition to pediatric home care, I would say go for it. If you're not 100% certain, test your feet in the waters. The program's phenomenal. You're going to broaden your skill set either way, and I'm confident that it's a good move for any nurse. The one-on-one care that you have the opportunity to provide is just, it's why almost everyone I know went to nursing school, was to provide that care. In the facilities, a lot of times you get this disjointed care. You're doing amazing things for people, and I don't want to take away from the work that they do. But when you have an opportunity to see somebody full spectrum, you start with them and then you're there with them 6 months, a year, 2 years. You have the opportunity to see the fruits of all the hard work that you put in, and it's very rewarding.
Do you feel that your transition from pediatric care to pediatric trach and vent care was an easy transition for you?
I feel like it was an easy transition. Okay, let me restate that. In regards to the transition from adult facility care to pediatric home care, I do feel like it was an easy transition, but it did require a lot of hard work. The support was there, the educational materials were there, everything, all the tools for success were in place. Is it an easy transition? No, but nothing in nursing is easy. Transitioning from adult care to pediatric home care can be very challenging, but all the tools and all the support is there. Okay. To anyone working in adult care that's considering making the transition to pediatric home care, I would say go for it. It's challenging, but it's worth it. It's just, there's nothing better than seeing a child through from 1 year to the next, 1 month to the next. It's just, there's nothing better than that. Knowing that you played such an important role in helping a child become seizure-free, go from having 30 seizures a day to becoming seizure-free and seeing their personality blossom. My precepting time with Betty was phenomenal. Pretty much any question I had, it was answered for me. There was no judgment, and Betty took a lot of time and a lot of her heart to provide good training for me, and to leave me very much prepared, more adequately prepared than I feel that I even needed to be. And it's something that I feel like I've had the opportunity to pass on to other nurses when I've had an opportunity to precept now too. So I felt very well prepared by my preceptor experience. The precepting time frame was adequate, but had it not been, my clinical manager and the office staff had been very clear that if I needed extra time to precept or if I needed additional training time, that they were going to provide it. Because at the end of the day, their motto, their focus at the office and here at Beata is we want it to be done right and we want to keep the clients safe. So there were no expenses spared as far as me getting adequate training. My precepting experience was excellent. My mentor really spent a lot of time not only making sure that I was comfortable working with the client, but that I was familiar with all the nuances of working with pediatric population versus the adult population, because my preceptor knew that I was making a transition. So there was a lot of emphasis put on different vital signs, psychosocial components, as far as seeing where a client is cognitively, developmentally, all these areas were made very clear for me, and I felt very comfortable doing a thorough assessment when I was done with my preceptor experience. During my preceptor experience, we started out with some shadow monitoring, which is an excellent way to start because you're just absorbing information rather than feeling like someone's watching you. In addition to that, it gives you an opportunity to not give the parents of the client any discomfort as you may appear to be fumbling, even though you know how to do everything very safely. From working in a hospital, they want to see a nice flow to what you're doing, and that's why it's really nice to shadow monitor initially with the preceptor, see the way they do things, the way the family's comfortable with things, and then as time progresses into the second and possibly a third day, it becomes more hands-on until the final day that I was precepting. It was me doing the whole show, and the preceptor was shadow monitoring me, giving advice and answering any questions I may have had at that time. The difference between hospital care, including trach vent experience, and home care with the trach vent experience is that, a concern you come in with is, where's that veteran nurse? Normally you go out right onto the floor and you'll go grab somebody. And when you're considering transitioning to home care, the concern is, am I going to be able to grab that veteran nurse in order to keep my patient or my client safe? And in transitioning to home care, that has absolutely been an option that has been available, is getting access to those veteran nurses and getting the help that you need when you need it. So in that way, the access to wonderful resources is the same as in the hospital. You're getting it a little bit different, but you're getting exactly what you need to provide good, competent care. But as far as the home care goes, where there's some differences is the psychosocial component. In a hospital, you really don't have a whole lot of time to engage somebody psychosocially. You may observe things, you may document them, but as far as actually integrating that into the care and helping to improve somebody psychosocially, you just don't really get the opportunity that you get at home if you are in a facility. And it's very rewarding to be able to provide that to a client. You're also able to see continuity of care from the whole spectrum. Whereas in the facilities and the hospitals, even if they're general floors, they're still specialized to some degree. And you're not going to see somebody through the whole spectrum of a disease process. You're not going to be able to be there present for a diagnosis and be able to be a support mechanism for the family and for the client, and help make sure that they have all their in detail clinical questions answered, and be able to be with them every step of the way, help provide guidance and corrections where need be, and provide care yourself. And then see the fruits of all that hard work come to bear down the road, 6 months, a year, where you had the opportunity to see a kid who may have been having 30 seizures a day to become seizure-free and is no longer withdrawn and is now a social butterfly. And there is nothing like that feeling that you'll get in a facility under any circumstances.